Good afternoon, everybody. Welcome to this recent briefing, our up-to-date briefing, which we're having today. We're having another one on Friday. And on Friday, Deputy Dudley Owen, President of Education, Sport and Culture, will be with us, and she'll be dealing with children's questions, and we'll be explaining how that can be opened at the end of the programme. So we look forward to receiving their questions. They were very perceptive and interesting last time. I'm sure they will be again this time. Three things to announce initially. And I think they're all good news. The first is that the Civil Contingency Authority, after due consideration, yesterday decided that as from Monday, this coming Monday, the 8th of March, Guernsey will move from stage 1 to stage 2. The second item is that tomorrow, Sark will move from stage 2 to stage 3. And the third item is that our commercial fishermen, who were used to landing their catch outside the bailiwick pre-COVID, again from today, they'll be able to do it. Another decision made by the Civil Contingency Authority, subject obviously to proper method statements to make sure that the virus isn't brought back and protections are made. So those are three, we believe, very good pieces of news. Now, on the panel with me today are Deputy Soulsby, the Chief Executive, Paul Whitfield, and of course, Dr. Brink. Now, Dr. Brink will be telling us, amongst other things when she speaks, about what liaison they've been with the education authorities, how the education settings are going to operate from a public health viewpoint from next Monday. Deputy Soulsby will tell you about these things called bubbles and also gatherings, and she'll explain that in more detail when she speaks. And the Chief Executive, Paul Whitfield, will deal with, because we've had, obviously, people have known that stage 2 is coming, and we've published guidance on websites and given information. And Mr. Whitfield will deal with what we believe are the current questions, the issues that have arisen, I should say, and other matters. So those are the key topics that we will deal with today. But let me say that the strategy is a working, living document. And in relation to that, it's not like a jigsaw that all the pieces will necessarily fit together and you end up with a complete picture at the end. But it's as best we can do. And it will be refined as the circumstances change. Now, what we want to do is get through stage 2 as safely and as practically as possible. And again, the point that I've made and everybody else has made, both on this panel, both the current team and other people that have joined it, is that the overwhelming consideration is safety. We're not going to do anything. We haven't made any decision that we believe puts in jeopardy safety. But of course, there are elements of risk. And I think Dr. Brink will emphasise, but I also emphasise, that when we move to the next stage next Monday, if there are things that you as individuals are not happy with and you don't want to do, don't do them. This just allows those that want to do things to do them. So there's no criticism of either. We just believe that we must, in the interests of Guernsey as a whole, having regard, as we have dutifully, and we will do so continuously, to the risk, we must move, and we should move from phase 1 to phase 2 then. Let me also deal with another topic that's been raised, and it's, when the borders going to open? We are actively considering that. We consider every issue. Just because we don't mention them on every broadcast, they are actively considered all the time. We will be considering that further, and we are considering it. And we would expect next 10 days, 2 weeks at the maximum, to be able to tell you where we think we can go in relation to that. I would just say, and I don't mean this as a criticism, the very able Professor Van Dam, who knows things well, is saying that in the UK, it's not certain that people are going to have their continental holidays this year. He wasn't saying that it wasn't going to happen. He was just saying it's not certain. So whatever we say will be the best information that we can give at the time. We fully appreciate people want to go on holiday, and even more importantly, because we are an island community with lots of people whose families are outside of these shores, we want them to be able to travel and as safely as they can, as quickly as they can. Anyway, enough of me again. Dr. Brink.
Thank you very much, Deputy Fairbrushe. And I'm going to give you an update of the figures as per usual. And just to say, once again, we're in an incredibly encouraging situation. So we're now into our 5th day. So we've got 4 days with absolutely no infections whatsoever. And that's despite testing about 1,000 samples easily per day. So we're testing large numbers and we're not seeing any cases. So that's incredibly encouraging and very good news for us. So if we look at slide 1, you can see the summary of the cases we've had, total of 511 cases during this whole wave. As of first thing this morning, we had only 13 active cases. I'm delighted to say as of 12 noon, it's down to 12 active cases. So we're progressing all the time. The vast majority of our cases have recovered, so 497 of them have recovered, and of course we must never forget the person that died in this wave. So overall,
we've got a frozen Dr. Brink at the moment. I'm sure she'll come back in a minute.
Am I back now?
You are indeed, Dr. Brink. Yeah.
Sorry, I'm not sure when I got frozen, but just to say a really optimistic picture. And now, as of 12 noon, only 12 active cases. So very pleased about that and looking forward to progressing further. I think the whole bailiwick is looking forward to progressing further. So if we go on to the next slide, I'm going to focus now on a few issues that were highlighted with regard to the school. So I'm using a slide that I've used before, but people mentioned that it was useful, and a few people asked me if we could show it again. So the first thing is, going back to school, we've worked closely with the Education Authority. We really are grateful for this partnership working, because I think this partnership working makes the environment as safe as we can make it. So to start off, we will have classroom bubbles for primary schools and indeed for years 7 to 9 as well. Older groups will be in year bubbles, but we'll have some testing around the year bubble groups. Now, the issue of social distancing within a school environment. And of course, particularly with younger children, this is not always possible. So what we've said is 1 meter whenever this is possible. And just to remind you, all of our what we call our non-pharmaceutical interventions, which are things like social distancing, hand hygiene and so on, are never modelled on 100% efficacy. So we say it's 1 meter where possible. We've got the enhanced cleaning regimens in schools, so that's over and above the usual cleaning, that additional cleaning. There's a testing strategy. I mentioned we'll be doing some testing in some of the older children, but we've also got a testing strategy for all staff members within the school. It is, of course, voluntary, but again, we're really grateful to how enthusiastically the staff have embraced this testing strategy. So we do appreciate that partnership working. Face coverings for older students and staff, we mentioned that before, and we will of course be doing a staggered start and finish time, and that's important because if you go back to the World Health Organization of crowds, proximity and so on, those guidance, we're trying to wherever possible mitigate for this, and there will be a limited transport to school. So all of that is the package we're putting together. We do believe it's important to get the children back to school. We know how important it is for their education, but also their wider health and well-being. And so we're looking forward to moving on with that on Monday. If we go to the next slide, and here I specifically want to mention pubs and restaurants, because that, of course, usually causes quite a lot of discussion. Now, basically, going back to first principles, the more interactions you have, the longer the interaction, the greater the risk of infection. So what we're trying to do in this interim period, and it is just a stepping stone, and it really isn't going to be for a long period of time, all things going well, is to just put our toe in the water and test it. So we've said 10 people per table. Now we understand, and Deputy Salisbury is going to talk about household bubbles, we understand people might want to see other people. So we've said 10 people per table, and they don't have to be part of your bubble. So they don't have to be part of your household bubble or indeed your household. With an alcoholic drink, we're wanting people to have food with an alcoholic drink. And again, it's just to the stepping stone as we move forward into stage 3, which we hope is going to be soon. We just want to make sure that we don't have any super spreading events. The aim of this whole program is to support not only the staff working in the restaurants and pubs, but also the well-being of their customers. And I think everyone would endorse that. And of course, we've said seated table service only. And so if you look at the location, proximity, time, all the time we're backing our back onto those World Health Organization principles and trying to move into the next stage as safely as we can. Now, the final thing that I'm going to talk about today is about the Brazilian variant. And I think you all are probably aware that 6 cases of the Brazilian variant have been diagnosed in the UK. And this is a variant of concern. They're known as VOX, or variants of concern. And interestingly, this variant first emerged towards the end of last year in Brazil and caused a very large second wave of infection. This was actually surprising because the area that it emerged in, a city called Manaus, had previously had a very large wave. So they thought a lot of the population had really been exposed to the virus. Despite this, they had this large second wave. So further sequencing of the virus showed that it in fact was a variant. Now, it is a variant of concern because there are some mutations in the spike in that S protein, and there is a concern that this might impact on vaccine efficacy. Data is very early, and it's a case of watch and wait at the moment, but it's something we are acutely aware of and we are watching. There's also a possibility that reinfection with this virus can occur. Again, it's something that we're watching very carefully. But importantly, this virus does appear to be very transmissible, possibly even more transmissible than the Kent variant of the virus. So it's certainly one that we want to watch and make sure that we have the appropriate procedures in place locally should we be unfortunate enough to encounter this virus. So hopefully that gives an overview from numbers to some of the specific concerns with regard to stage 2, but also looking into the future, looking at how we continue moving and trying to protect our island population. So thank you very much, Deputy Fairbrash.
Thank you, Deb. I always think you say Deputy Brink because you've got more wisdom than the deputies. But I'm handing over now to a very wise deputy, Deputy Salisbury, who's going to tell us about bubbles and gatherings.
Thank you, Deputy Fairbrash. Yes, we went through a lot of information on Monday about guidance for stage 2, and apologies if it felt like too much, but we wanted to do it there, not just because Alderney was moving to stage 2 the next day, but to get it out there early to explain why we have set the rules as we have and to enable us to deal with the questions you might have over the course of the week. So that's what we're beginning to do today. And one area where we've had a lot of questions, just as last year, is around bubbles and gatherings. From Monday, you can expand your household bubble from 2 households in a bubble to 4. That 4 household bubble must be exclusive. You can't switch and swap once your bubble is formed. It doesn't matter how many people are in those 4 households, just that it's not more than 4 households, including your own. If you're in a bubble together, you can be in each other's houses or gardens without social distancing and without face coverings. That's the point of the bubble, just like last time. Now, gatherings are different. These are where you meet up with people who are outside your bubble. We've put rules for gatherings in place because we're taking a step towards unlocking and we're getting more socialising, activities and events going on again. But we have to do it carefully, as Dr. Brink said. If we put no limits on gatherings, there'd be little to prevent the spread of the virus should it still be here. But at the same time, if we don't allow bigger gatherings, it wouldn't be proportionate to where we are, with the virus currently under control. We don't want to undo all the good work the community has already done. So I'll just go over the rules for gatherings. Indoor gatherings are limited to up to 20 people, and outdoor gatherings are limited to up to 30 people. Now, indoor gatherings do not mean in your house. Outdoor gatherings don't mean in your garden. Your house and garden is somewhere only for your bubble. Indoor gatherings might be an event in a hall or community centre. It could be for a wedding or a birthday party. It could be Friday night bingo or euchre. Whatever it's for, it shouldn't be in someone's house. If you want to meet outdoors with people from outside your bubble, the limit is 30. Now, it's more than indoors because we know the risk of transmission is lower outside. There's been a number of additional questions around gatherings, and I'll cover them now. Should you socially distance in your indoor or outdoor gathering? Yes, and someone should keep a record of who's in that gathering to help our contact tracing team should anyone later test positive. Should you wear a face mask if you're at a gathering? Yes, except of course when you're eating or drinking. Are there exceptions? Yes, for example, cafes, restaurants and pubs. Dr. Brink has already dealt with the issue of serving food with alcohol, but I'll comment on the numbers of people at a table. We're saying it's no more than 10 people at a table, and this has raised questions as it's fewer than the general limit on indoor gatherings of 20. The reason for this is that those 10 can be from any household. It's harder to socially distance when you're sat round a table. You're likely to be there for some time and not wearing a mask while you eat and drink. It's also worth remembering that while tables will only be a maximum of 10, there will be more people in the room with staff and other tables of customers. Now, with all of these rules, we're trying to allow as much normal activity as we can, but we can't take the brakes off entirely, not yet. That's why we're trying to strike a really difficult balance. We want to look at every area of life, socialising, business, education, and help everyone do as much as they can safely. We also want to make sure if we see an instance of the virus spreading in any of these settings, we can keep it under control and that our contact tracing team can work effectively. The numbers of people in each setting, whether it's 10, 20 or 30, may seem plucked out of the air. And to be honest with you, this is no perfect science. We're making our best risk-based assessment of what we think we can manage with our very good levels of testing. We also know how hard it has been second time round, and we want to avoid this having to happen again. We really do understand that having to take in lots of new rules is tiring and irritating, and we know how desperate many people are to get back to normal. However, we are already getting through this lockdown faster than last time because the community has done what we asked. And if we follow these rules now, we will be out of this far ahead of what we managed first time around. And finally, I'd like to say something to those who are nervous about the changes we're making, who don't really feel ready to extend their bubbles or go out and meet others. Well, you don't have to. This is all about what you can do now, not what you must do. Do what makes you feel comfortable. We're at the stage, like last year, when some think we're going too quickly and others think we should hold back a bit. We understand that, but are trying to strike a balance such that, just like baby bear's porridge, we get it just right. Thank you.
Thank you very much for that. Chief Executive Paul Whitfield will now deal with certain matters.
Thank you, Deputy Fairbrush. We are acutely aware that on Monday we published a huge amount of guidance, and I'll speak briefly now about the rules for businesses, mainly just to act as a reminder. The benefit of publishing that Stage 2 guidance a week in advance was that it has given us all, members of the community and businesses, a week to understand what is meant for them. And if any business owner or manager has not yet read the Stage 2 guidance, I would strongly urge them to do so. And if any business, I would strongly ask that while there are different rules for different sectors as we seek to begin opening up the economy as quickly, but most importantly as safely as possible, there are some key principles for businesses to follow. They are all on our COVID website, but I'll again highlight a few now. The first one is that staff should continue to work from home where it's possible to do so. If remote working can work for your business, then please continue to make it work. If you can't, then your business must operate in adherence to public health guidelines. The only exception will be nightclubs, which will not be permitted to open until Stage 3. Remember that a business, you must keep records of everyone present on the premises, unless a business is operating in an uncontrolled environment, for example, such as large retail stores. This means employers must maintain records of people visiting the premises, including staff, clients and customers, delivery personnel, and all other visitors, as well as the details of off-site visits made by staff. In the event that a positive COVID-19 case is identified and linked to a business, club or facility, there will be a requirement to provide immediate full lists of contacts. So this is really important. Since Monday, we've had around 125 new notifications from businesses of their intention to operate in Stage 2. This brings the total up to nearly 1,700 businesses. While there is a very strict requirement for businesses to notify us of their intention to operate in Stage 2, If you've already notified us because you were operating in stage 1, then you don't need to do it again. This is for any business about to reopen as part of stage 2. The notification form can be found on the business section of our COVID website. Our trade team have been supporting businesses where there has been a need for clarity around their specific operating circumstances. If you're a business owner or a manager that needs advice, bearing in mind, please, this isn't a means to seek approval, as the notification system is in place for you to self-declare that you understand and will abide by the stage 2 rules. Then you can contact the team on 717-245. That's 717-245. That number is also published on the website. Before handing back to Deputy Furbrush, I just want to briefly update on the vaccination programme, which has now successfully administered more than 22,000 doses of vaccine, either via the community vaccination centre or indeed our community nursing teams or by colleagues in primary care. Yesterday, we began to send out easy read letters to adults in our community with a learning disability. The letter will invite their main carer to receive their vaccine at the same time. These appointments will be at a special vaccination clinic being held on the 8th of March in the community vaccination centre. It will be quieter. We are expecting around 460 people if all those invited take up the offer of the vaccine. And chairs will be set out in pairs, so those who attend in pairs can sit together with those they care for. Space will also be set aside for those who need to wait for 15 minutes after their vaccine, but are unable to easily sit for a length of time. Letters will also be going out this week to those identified by their primary care practice as a moderate to high risk and age between 18 to 65 years. This is a priority group 6. There are around 6,600 in this group, and letters will be sent out in batches of 500, starting with the oldest in the group of people first. So please be patient if you think you're in this group, but don't hear from us immediately. And separately, as we've mentioned previously, we have sought to establish how many people are currently in the island who fall within our priority vaccination groups of 1 to 9, but who aren't ordinarily resident in the island. These people are often family here to support others in the community, and there is both a moral obligation to vaccinate them as they are in those more vulnerable groups, and also a health implication if they were indeed to become ill with COVID-19 while here, and therefore impact our infrastructure and community. We have been contacted by about 210 individuals who are non-resident. About 100 of those people fall into the priority groups 1 to 9. All non-residents who have notified us will be written to this week, confirming they will be on the vaccination schedule. Invites for vaccinations will follow the 1 to 9 category age groups, and others will fall into the later phase 2. The first people to be contacted will be those over 65 years of age. And finally, on vaccines, we will be inviting those people who care for a member of their household to make an appointment to receive their vaccine. Carers are often the hidden heroes in the bailiwick and do a huge amount of support for their relatives to stay in their own homes by providing support directly to those that they care for. It is important this group are vaccinated to ensure they are protected from COVID-19 along with those they care for. We'll have more information on the timescale for this group receiving their invitations later this week. Thank you, Deputy Furbrush.
Thank you very much. I'm grateful to all three of my colleagues for their very helpful and informative presentations. It's now for the media to ask their questions. Could I have a hand up, please, so that I can come to you? Yes, Juliet Puto from the press.
Good afternoon, panel. Just following on from the update there on vaccines, I noticed that last week, obviously, the numbers being vaccinated were lower, and I think that was due to obviously there being fewer vaccines available. In the UK, they've set a very ambitious target of completing all their 1 to 9s by the 15th of April, which obviously is only 6 weeks away. Are we confident that we're also going to be able to hit that target?
Dr. Brigg.
Thank you. We're hopeful that we will be on target. We are getting additional vaccinations in over the next few weeks, which has been really welcome news for us. So we'll proceed as fast as we can with all of the vaccines we receive. And as we've always said, we receive 0.1% of the UK allocation, and we don't have any spare vaccine. We're vaccinating as fast as we can. So if we get the vaccines, yes, we should be on target.
Thank you very much for that. Hamish Oscary.
Thank you. Yes, I see in the guidance for stage 2 that extracurricular activities are not allowed for the under 18s, for example, sports clubs, for example. I wondered if you could explain why that is, and in particular, a question from a viewer is asking whether or not socially distanced one-to-one horse riding coaching would be allowed in the next stage.
I think perhaps I could come to you, Paul Whitfield.
Yeah, I think that can be accommodated if we follow, again, the method statement. At the moment, people go out and cycle in pairs, people walk in pairs, again, applying social distancing, and it would require the same sort of hygiene measures, social distancing that we would apply elsewhere.
Okay, Matthew Leach.
The guidelines are fairly extensive and complex in stage 2. How do you explain placing your trust firmly in us, the general public?
Well, I think a great deal of trust is being placed in the general public because how could anybody? We live in a democratic, liberal society where we want people to live as freely as they can and more freely than they can now. So we haven't got 63,000 policemen to go around and walk behind everybody. But equally, they will be enforced. The police officers will conscientiously do their jobs. They will be enforced. But there can be no guarantee that everybody who breaches the rules will be caught. But equally, and I'm sure there won't be many, but if there are some that are going to breach the rules, they've got to be looking over their shoulder because they could well be caught. And if they're caught, and if it's a prosecutable offence, they will be prosecuted. Jim Delbridge.
Thank you, panel. We've heard that the Isle of Man is going back into lockdown, sadly, I believe from today. Now, I know in the past when I've spoken or asked you about this, you've said that you are in close contact with your associates in the Isle of Man. I just wonder if there's any lessons that Guernsey has learned from their experience over there, which you could share with us today. Thank you.
Dr. Brink, I know, speaks very regularly to her equivalent in the Isle of Man. Anything you could say, Dr. Brink?
Oh, I'm actually due to speak to her tomorrow, so I haven't spoken to her for the last week. But I think, as always, I think the variant virus that we're all seeing, there are lessons to be learned with regard to the speed in which we come out. And that's why we want to be cautious. We want to hold on to what we've got, but at the same time progress fast enough. So I think that's important. And I think the situation that we're in now with no detectable cases is really positive, but we've still got to come out slowly and make sure that nothing bubbles up. And if it does, we can then cope with it very quickly.
Yeah, I think also I would say in answer to Jim's question as well, they're very well run in the Isle of Man. They've done, I believe, from what I've seen, a splendid job. And we commiserate with them. And it just shows that these things can happen. So you've got to be ever vigilant, which they have been. I don't see Ewan hasn't put his so because he hasn't asked a question yet. Yes, he has. Ewan, your question.
Can't silence me for that long. Ewan Duncan from BBC Guernsey, just picking up on the Isle of Man. And I know that their cases have come from their equivalent of Condor and the staff bringing that on island. I know that we do things here differently in Guernsey. We know that we have UK staff and Guernsey staff, and they don't cross at all. Is there a risk of, I know you've talked about the Brazilian variant, Dr. Brink, is there a risk of another variant and moving into potentially a third lockdown further down the line? Or are we coming towards a point now with more vaccinations taking place that this is now going to be a virus which is very common, and therefore it becomes a bit more like the flu? And what stage will we get to with that? What sort of category of the vaccinations will we be thinking about that?
Dr. Brink.
Thank you, and that's a really good question, Ewan. I mean, what you're talking about is moving from a pandemic to an endemic situation, and yes, that has to come. We are looking at this at the moment and doing some modelling on this, and so we're hoping to provide more definitive guidance in the foreseeable future. But I think we will move to a situation where we consider SARS-CoV-2, the virus that causes COVID-19, as a pandemic, into an endemic situation. But then what we might do within that endemic situation, focus on very specific mutations that could be of concern. So the ones with enhanced morbidity and mortality, so disease and death, but specifically the ones that we think could escape the vaccination program. So you're right, there has to be a change. And as the increasing proportion of the population becomes vaccinated, we will see this. And in fact, if you look at the second wave, which hit us far less, although numerically it's been bigger, is the morbidity and mortality associated with the second wave has been far lower. And that's because the most vulnerable in our society were vaccinated.
Thank you. Jim Delbridge and then Juliet Puto. But Jim, your question first, please.
Yes. I asked something similar a couple of weeks ago. I was really just looking for more of an update. That is, number of boaters over here, boat owners, love going to France, spending a day in various ports around the French coast. What is the position? And moving forward, I know you don't have a crystal ball, you can't predict exactly what's going to happen, but general advice, please, about people, boat owners who'd like to go to France, come back again. Will there be a degree of self-isolation? Will we need permits to actually travel to France and come back again? All of that kind of thing. Thank you.
I'll come to Dr. Brink in a moment, but it depends on timing, really, Jim. I mean, at the moment, France is not in a good place. They haven't vaccinated a lot of people. They have got rising numbers of COVID. But, you're talking about the longer term. As soon as it's possible, it will happen. But I think it's some time off yet. And of course, there's talk about a COVID or vaccination passport, both in Europe and elsewhere. That's all being looked at too. We're considering that too. Anything you want to add, Dr. Brink?
I think just to say the prevalence in France at the moment is above 400 per 100,000. So their prevalence is high at the moment. And as Deputy Fairbrash said, it does depend on the prevalence of infection, but also as we move to what we're calling frictionless travel, is what other mitigations like vaccination and so on we have in place. So yes, it will come in the future, but we're just not there yet.
Thank you. Juliet, your question, please.
I think it's probably a question for Dr. Brink. Dr. Brink, you mentioned about obviously doing about the concerns about variants, and obviously we did do variant testing of our first 4 cases that were found. Have we done any variant testing since then, and what's been the logic behind that?
Good question. Dr. Brink.
Yes, we have done variant testing. So what we've done is we wanted to determine whether this whole wave was caused by the B117, so the Kent variant. And so we've sequentially tested over the weeks, we've sequentially tested a number of samples from each week, and all of them have been the B117, so the Kent variant of the virus. The logic for that is that we can define that we're probably dealing with a single wave and not multiple introductions of different variants. So the knowledge of that it was a singular viral type that came in helps with planning our control measures. So we didn't have multiple sources of introduction as far as we can determine.
Thank you. Matthew Leach.
Thank you. If you'll allow, my question is a political two-parter and directed to Deputy Fairbrash.
Right.
When the CCA was created in 2016, it was to prepare for emergency situations and reduce their impact. Will you be committing to reviewing the CCA's decision-making processes to highlight what has worked well and identify areas that could be improved? And secondly, given that the CCA voting members do not include economic development or education, yet both have been greatly affected by this pandemic, do you think the membership of the CCA could be more flexible?
The answer to your first question is yes. Certainly, the point that you make it implicitly in your question is correct. We look at the processes and we're going to try and improve them, change them, etc., etc. And that'll be a statewide decision, not just for the CCA, because the CCA reports to the states periodically as it must. and it's subject to the democratic purview and overview of the states. And in relation to the second, we have consulted regularly now with Deputy Dudley Owen for obvious reasons about opening of schools shortly. We do have regard to economic matters, but as to the idea, when it was set up under the law, the idea was that it was slick and fast. My own view is that that's how it should remain whilst it's dealing with an emergency. And for example, you've made the point about economic development. Well, of course, we need to speak to Deputy Inder. We do when we need to. I don't mean that need to in the sense of in any pejorative sense, because you'd have a difficulty keeping Deputy Inder quiet unless he wanted you to. But we do consult with, and we would. We had, and I'll come to you in a moment, Whitfield. We had the head of law enforcement on the panel very recently because there were law enforcement issues. But you're right. I mean, it's something that should be kept under review. Nobody's got all the knowledge, and we want to gain it from as many facets as we can before we make the decision. Mr. Whitfield.
Yes, it was just to add to that point that actually now within the legislation and the structure of the CCA, the CCA indeed can call in anybody it deems it needs to assist its decision making or its information or its advice. So that could be indeed other presidents, but it can also be other staff members, but it could also be a subject expert if it really needed to hear from a subject expert.
Thank you. Deputy Salisbury.
Thank you. Yes, I think when the CCA was envisaged, it was for something that would happen, an emergency as we would normally think of, something like a plane crashing or something, an immediate response to a crisis, not something that would last months and potentially years. And I think that's one of the learning experiences we need to think about and what could be done differently in the future. But I think it served its purpose, and we're quite lucky having the mechanism which other jurisdictions haven't had. And but we can always learn. And absolutely, after all this, we'll be looking at what the learning points.
Yeah. Hamish, your question, please.
Thank you. Just to return to the stage 2 guidelines, I'm being asked by a hotel owner, can hotels offer on-island guests staycations, and when can they hope to be able to welcome guests from around the bailiwick?
Paul?
Yeah, my understanding that's lined up for stage 3. It's not stage 2. But of course, I think we're really keen, as we see and as being articulated by Dr. Brink, the potential for us to successfully move to stage 3 will mean we'll have to be able to start looking again against those bailiwick staycations we've all enjoyed in the past.
Thank you. You and Duncan.
Sorry. I'm just quite interested to know what indicators will be needed for us to move to stage 3. We've obviously seen Sark and Alderney move to those stages in a relatively quick period of time, but obviously they haven't had the cases that we've had here in Guernsey. But now with 4 days of no new cases reported, which is obviously fantastic, does that give us confidence to move quite quickly to stage 3, or will there be a bit more caution in Guernsey?
Well, we're going to be cautious, but the question's a good one. We are intending to move to stage 3 as quickly as we can. And the fact that you've indicated we've had no cases for 4 days, and even if we get another one, which, odds are there will be other cases, sadly, hopefully not, but there will be, more likely than not, then it depends on how that case arises, how traceable it is, etc., etc. But yeah, the idea is we want to get from stage 2 next week to stage 3 as quickly as we can. We don't want to be in it for weeks and weeks and weeks. So a very good point raised. And I think it is your turn now, Hamish. Sorry about that.
It's just to follow on from that question, really. In the early stages of this lockdown, Dr. Brink talked about an up to 14-day period with no cases of community transmission for us to be able to withdraw from lockdown. Has that clock started now with this 4.5 days of no cases, or does that need to respond to the changes that and the extra risk that comes with stage 2?
Dr. Brink?
So we need to look at those 14 days with the extra risk that starts with stage 2. But the fact that we're going into stage 2 in such good shape really bodes well for us. And with regard to, we didn't say no community cases. It's no community cases that we feel we can't control, because we might get a case popping up in the community which we jump on really quickly and we control really well. That doesn't mean that the clock needs to restart. But if we had sort of 5 or 6 cases jumping up around the community, I'd be having a different conversation. So I think that's really important to focus on that. It's not no community cases. It's no community cases that we can control with our contact tracing and isolation policies.
Thank you. Jim Delbridge.
Thank you, panel. I think a question for Deputy Soulsby. Thank you very much for clarification regarding restaurants, pubs, etc. A further question from a listener this time. She understands that she can go to a restaurant and meet somebody who isn't in her bubble, but she cannot go to their house and meet them. Her point is that when you go to a pub or a restaurant, the toilets there are used by a whole big range of strangers, whereas at the private house, they're not. So can you just reassure her and maybe give us some thinking on what the thinking is behind this, please?
Deputy Salisbury.
Yeah, I mean, I think we were trying to say within what we said earlier is about the transmissions that we found is really went through the households, and that's where we've seen the biggest risk. I think Dr. Brink can explain more that the reasoning why we're doing it, but what we're also doing, we're restricting those contacts wherever it is. So although we're allowing somebody to meet in a pub and a restaurant, we're also limiting the number of people that can do so. So it's not without risk anywhere, but what we're trying to do is those people that can be close to each other, don't have to worry about social distancing, they don't have to wear masks, can do so in a household environment. But outside of there's got to be more consideration of social distancing, wearing masks, and making sure that we have less contact with people outside as much as we can.
But again, as part of the hotel, part of the restaurant stroke pub, they've got to come up with a method statement. They'll have to deal with cleaning of toilets, access to and going out of toilets. All of that will be covered as well. It's not just where you go to the restaurant and you just go in and out the toilet as you would normally. There'll be a regime, and the onus is upon the runner of the hotel or restaurant. Hotels have restaurants too, and pubs to make sure that that's carried out. Juliet, your question, please.
I've got an education question, which I'm hoping the panel might be able to answer.
Right.
We've talked about testing taking place in schools and obviously teachers being regularly tested, but I think there also has been mentioned in the past about students needing to be tested as well.
Yeah.
What sort of ages are you looking to be testing, and obviously what sort of percentage of students are you looking to test to obviously get a clear picture of what's taking place in the schools?
Dr. Brink.
Thank you very much. So specifically the groups that we're testing are the groups that we can't put into smaller bubbles. So these are some of the key stage 4 and 5. So it's the older children. So the GCSE and the A-level type of ages. So that's really important. It's those older children that we can't put into smaller bubbles. So the years 6 to 9 in secondary school and primary school children, they all can be put into classroom bubbles and can be managed within that way. So that's the first thing. The second thing is the testing will be entirely voluntary. We're planning to use PCR-based assays for these students, and it will be a self-taken swab. So I hope that summarises it for you.
Thank you very much indeed. Bailiwick, Press Matthew, your question.
Yes, thank you very much. I'm just seeking some clarification from a comment made earlier in this briefing. Mr. Whitfield, you mentioned that if you can work from home, you must. But online guidance says people are just encouraged to. Which one is it?
Mr. Whitfield.
Well, obviously, it's hugely encouraged that if you are able to run your business or do your business from home, we encourage that the majority of your workers continue to do so. But we also understand that in opening even the more administrative office-based environments, that having a number of people in the office environment can accommodate people working at home doing more and more effectively by them being able to access things that they have based in the office. So that's why we've also allowed numbers to reach out to be able to operate in the office environment. But the emphasis, and I'll go back to it, is in stage 2 to control numbers and to keep numbers down. So where we can work at home, work at home.
Thank you. Ewan Duncan, your question, please.
I've got a couple questions about phase 2. We've sort of seen in the UK a bit of a laugh and joke what constitutes food in a pub. Some are saying it's a Scotch egg, others are saying it's a bit of a meal. Can we have some clarity on that, please? And also a question from a listener who says, what's it going to mean for private companies such as cleaners being able to go into people's houses again?
Do you want to pick that up, Mr. Whitfield? Or?
Yeah, I think Deputy Salisbury would agree with me on when we were dealing with the first wave. We got into an awful mess trying to decide what constituted a meal. So this time we've been more broader in terms of describing that. So we're not going to specify what people actually eat, other than that they purchase food.
Okay, I'm just looking. Hamish, your question.
Thank you. It's a question about the vaccine, and it's from a viewer. They said they had the vaccine, they felt fine until day 8, and then they felt dizzy and washed out. She wants to know if many people have reported side effects like this, and I think she wants some reassurance that she's not going to feel worse after the second jab.
Dr. Brink.
It's unusual to have those symptoms on day 8. First 48 hours, absolutely. I would be encouraging her to actually speak to her GP about this. I think it would be important to make sure whether that was vaccine related or in fact it was something entirely different. So I think that needs a bit of a more detailed clinical assessment and opinion rather than just a comment in a press briefing.
Okay. What about people, though, that when they get their second dose? I think that was also Ewan Duncan's question.
Yeah. So with the second dose, absolutely, and some people will feel worse after the second dose than the first dose, and that is something we've seen. But most people will, 48 hours after that, will be entirely fine.
Thank you. Juliet, your question?
Yes, it's relating to, I'm afraid, the phase 2 of vaccinations, which I know is still a little bit of the way down the road yet. But we have had some teachers getting in touch with us at the newspaper who are obviously concerned about schools going back and are keen to be vaccinated. I think I'm interested to just try and find out, obviously, what the process is about negotiating it for us to change our prioritisation, how long that could take, and when will it obviously be announced, what it will look like.
Well, yeah, thank you. I mean, there are discussions going on with the UK authorities because we would like, and I know that the Health and Social Care would like, because I think they've made that decision, to at stage 2 is to in tandem with the 45 to 49-year-olds, 40 to 45-year-olds, is also make sure that teachers, police officers, prison officers, etc., get their. So those negotiations are continuing, and that's the intent of Health and Social Care, and of course that will be absolutely endorsed both by Dr. Brink and by the Civil Contingency Authority. Now, the only person I see with their hand up at the moment is Ewan Duncan, so I'll go back to you, Ewan.
Yeah, sorry, I think, Paul, you just forgot to answer the second part of my question about what will be allowed in stage 2 in regards to potentially cleaners going into houses. And then another listener's called and said they're a mobile hairdresser. Is that going to be possible? And I suppose the same is for beauticians. And I suppose we should pick up on people supplying care, so like physios or occupational therapists, that kind of idea.
Yeah, sorry about that. Paul Whitfield.
Yeah, I would say not entry into households at this stage. I think it goes back to the very good points that have been emphasised by Deputy Salisbury this afternoon, that because of the high transmission rates experienced in the domestic setting, this is different than the first wave we experienced. The new variant is seen to be very contagious, and we've seen within the family setting or the household setting almost entire household transmission, all but a few cases. So therefore, to then put businesses back operating within that sort of domestic environment at this stage would obviously be a bit of a contradiction to what we're trying to achieve. But I would say, given the success of where we are, and we really hope that continues, that we should be with a fair wind in stage 2 for a relatively short period of time.
Thank you. Matthew Leach.
I have a final question here for Dr. Brink. Questions have been raised about the accuracy of lateral flow tests in the British Medical Journal, tests which I believe will be used in school testing programmes. Could we expect a number of positive cases on Monday which will need a follow-up PCR test to confirm whether they are genuine?
Dr. Brink.
First of all, I think it's important to define the difference between sensitivity and specificity. The particular concerns that have been expressed about lateral flows is they are slightly less sensitive than the PCR-based assays. So that's a really important thing. So they're quite specific, but we would always confirm any positive result with a formal PCR. So no, we're not expecting huge numbers of positive results as a result of the lateral flow assay. I think that's really important. The other concerns that have been expressed have been largely operator dependent. Now, we know lateral flows are best used in trained staff members or people that have been specifically, so members of the laboratory or staff that have been particularly trained to do the assay themselves. When it was given to students and so on, the sensitivity and the accuracy of the tests went down. So it's all to do with a thorough training program. We're going to be using a blend of PCR and lateral flow. We're going to be using PCR-based assays for any testing of students, and the lateral flow assays will be brought in after we're going to wash through all the staff with a PCR-based assay in the first instance, and then that will be our follow-on surveillance program that we bring into play. So we're using both. The other thing is we've done our research on the lateral flow assays very carefully, and the lateral flow assay that we've selected will also pick up the variant virus as well. So we've been very careful in what assay we've chosen. So we're not expecting huge numbers of false positive results.
Thank you very much, Dr. Brink. Juliet Puto.
Yes, there's been quite a lot of discussion over the water in Jersey with the Easter holidays coming up and concerns about boarding school children being able to have access to their parents. Obviously, I imagine there probably isn't going to be a dispensation for those students to come back during the Easter holidays, but will parents possibly be able to go see their children and get permits to come back if they possibly haven't seen their children for several months?
I mean, again, I invite my colleagues to jump in if they think I'm missaying it. The answer is probably not, because we're at that stage at the moment where we've still got to be vigilant, but we want to move through that as quickly as possible. But difficulty is, and it's a general point, a bit wider than you, more travel out of the island, more travel back into the island, the more risk at this stage of something happening. Despite all the tests, despite everything else, despite the great facilities that we've made available, there is a risk. So there is still the general ethos is to minimise travel onto and off the island to make the island safe, because we've seen what's happened recently in the Isle of Man, despite all their tests, despite all the precautions they've taken. And they are a very well-run jurisdiction, the Isle of Man. So it's not as though they've been cavalier. They've had that difficulty, and therefore their chief minister had no option but to close them down for 3 weeks. Who have I got? I've only got Ewan's hand up, so Ewan, I'll come back to you.
Just on the topic of permits, we saw yesterday that 5 people are being investigated for possibly entering the island without a permit. A couple of questions on that one. How is that allowed to happen if it did happen? And were they checked on entry and also in isolation? And what's the ongoing matter with this, if you can say?
Yeah, I don't have any detail. Mr. Whitfield, do you have any details?
No, I don't have the exact detail, but certainly we can find out the background to this and provide better sort of open information at the next briefing.
Okay. I hope that helps you. And sorry, not trying to avoid the question. We just don't have a sensible, detailed answer for you at the moment. We don't want to speculate, as you appreciate. But clearly everything is being looked into. I do not see anybody else's hand up. So I think, I'm just looking carefully. I don't see it. So that, I think, concludes today's briefing. We've got another one on Friday. And as I say, Deputy Dudley Owen from Education will be with us. Children's questions will be able to be asked. That facility will be shown soon how the children can forward their questions, and we look forward to receiving them, and we look forward to you being with us again on Friday at 1 o'clock. Thank you very much indeed.